Welcome to the Slop Farm. Enjoy the video.
You start by getting a professional baseline. Make an appointment with an ophthalmologist or optometrist now. This is non-negotiable. Once booked, assemble your medical history, list medications, and bring your current glasses and contact lenses. Make sure you stop overnight contact lens use and avoid intense screen time 24 hours before testing. You do this so the clinician can measure true refractive error and eye health. Accuracy here determines every step that follows. Once the exam is done, you move into diagnostics and decision-making. Expect objective refraction, imaging like OCT, slit lamp exam, and pressure checks so providers can identify underlying causes beyond simple refractive error. Make sure to discuss each treatment option: updated prescription lenses, specialty contact fits, orthocratology, or refractive surgery such as LASIK or PRK. Ask about risks, recovery timelines, and realistic outcomes. This lets you choose the single best path tailored to your lifestyle. You finish by strictly following the prescribed plan and attending follow-ups. After treatment or new prescription fitting, use medications, drops, or lenses exactly as instructed and keep scheduled checks at 1 day, 1 week, and subsequent visits to confirm healing and visual stability. Once done, track vision changes and note any irritation or halos. If you experience severe pain, sudden vision loss, flashes, or marked redness, make sure to contact your eye care provider immediately. Early intervention.
Thanks for watching. Consider subscribing if we helped you today.